Hi, this is Bruce Quinn, and I'm presenting a simple PowerPoint demonstration of how to use the giant 10 million line 2 gigabyte Medicare database that was released in April for the first time. This includes essentially every claim billed by every doctor and independent laboratory in the United States for a service to Medicare. It's based on the 10,000 or more Cpt codes that are available to define each physician service. So there's one Cpt code for a simple office visit, another Cpt code for an appendectomy, another Cpt code for a chiropractic care visit, another Cpt code for any one of 1,000 laboratory tests, and also many drugs that are injectable, like injectable cancer drugs given in physician offices, are also in the database. This got a lot of media in April 2014. There had been a number of parties, including the Wall Street Journal, that had been dealing with Medicare in court for a number of years to have data released on the basis that these are federal payments to parties that are contracting with the government. So just like you might want to know how much Lockheed was paid by the government, the same principle, you should be able to know how much Dr. Smith on 100 Oak Street was also paid by the government. So this got a lot of coverage immediately in the online media, television, New York Times, Washington Post, and Wall Street Journal. The newspapers, like the Wall Street Journal, also created simplified databases that let you look up a doctor and see how much he was paid for Medicare. So example, here's a link from the Wall Street Journal. The New York Times also has a very similar consumer-friendly website where you can put in a doctor's name and his zip code. But if you go to CMS, which we showed their press release here, they call this a historic release of data with unprecedented transparency. You can also figure out how to do this yourself and get into an enormous body of detail that you cannot get from the newspaper websites. The simplest way to find where this data is at Medicare, here I've Googled Medicare releases physician data, and the top link is this website. And here at the top of the page, I've shown the actual web link, and then the web page is here. And the key thing, though, are these data files. And I'm going to use this short, simple video to show you the data files. You'll notice I'm going to show the entire thing in screenshots on PowerPoint. There are two reasons for this. Some of these data files are huge. They're 200 megabytes. They're 1 million lines long. They take 2 or 3 minutes to open on my computer. So it'd be very tedious to show you the live spreadsheets. The other thing is these are full of doctors' names and addresses, and even though you can download these yourselves, I'm not going to show you the names and addresses in my PowerPoint. So these are the data that you can get. First, you have the entire database. This is 1.7 gigabytes. When it's uncompressed, you cannot use it in Excel. You have to use it in large-scale professional database software. I do not have that. Then they give you about 10 files here, which are physician data files broken down so that they're all less than 200 megabytes. The A's are one file, the B's are one file, the CD's are another file, and these can be anywhere from 200,000 to 900,000 lines long. You'll see more about what they look like. Then they give you two summary tables. The first is a physician and supplier aggregate table. So this shows every doctor, lab, supplier in the Medicare program, and it's just one line. How much were they paid in total? $10,000, $100,000, $200,000. That's never been released before. It's a relatively small database. Then they have a database by what are called HCPCS tables or Cpt codes. And this shows you every one of the Cpt codes, such as 99204 office visit 20 minutes. And it shows you how much it's used in the United States, and then about 50 more lines for how much is used in every state. There are actually a lot of small variations because there's like a European military and Marianas Islands. So it's more than just the 50 states, but it's basically the 50 states. The calendar year data is from 2012, but that's not really old because it's not completed till December 31st, 2012. And the data is not mostly in until at least the following summer. For example, if a doctor sees a patient on December 30th of 2012, that doctor has got a full year before he has to submit a claim to Medicare. So you can't know what the data was on January 1st of the next year. As I said, I'll be showing Excel screenshots because the data is slow to open, and this lets me hide the provider names. So the first question I thought I'd ask is how many doctors with XY names billed for psychoanalysis? I was pretty sure this would not offend any company that I've ever worked for as a consultant. And first, let's check the national billing. So this is the national and state HCPCS aggregate database. So it's every CPT code, 00100, 00102, 00103, and so on. The first codes happen to be anesthesiology codes. And you can see, the place of service, a facility or an office, the number of providers who billed that code. This code, anesthesia for lens surgery, was billed by 23,000 providers on 2 million lines of service for 1,700,000 unique beneficiaries. So you get an idea how big this database is. And we will now focus, however, on just the HCPCS code box, which is a drawdown box that lets you use the drawdown as a filter. So what we do here, we go to the drawdown box and we unselect all. When it comes, all the codes are selected, so deselect all, and then dig down around in there. I'm doing 90945. I think that's psychoanalysis. Well, I was wrong. I clicked 90945, which is the dialysis, one visit evaluation, and I wanted 90845, which is psychoanalysis. So I go back to the drop-down box and I do 90845, and it turns out 90845 psychoanalysis is almost unknown in the Medicare program. Apparently, only 2 doctors were billing it, and they were both based in New York because the 2 doctors in New York are the same as the 2 doctors in the United States. Those 2 doctors did, however, bill about 800 services and apparently for 130 different beneficiaries, so about 5 visits per beneficiary. And Medicare was only paying them $82 for an hour of work, so that's probably why not many people find that popular. There are regular codes for psychiatry, not psychoanalysis, and those are used by the millions. So let's try again. Let's do a different code. Oops. Oh, I have a typo here. I put down 99202, but I think I'm actually searching on 99204. But other than that typo, we'll go on with the same story. This 99202, I think, is a 20-minute office visit. I may have searched on 99204, which I think is a 40-minute office visit. Nope, I did do 99202. Okay, so there it is. It could be that I screw up and later use 99204. Anyway, there's 99202. There were 46,000 visits in the United States in an office, 5,600 visits in a facility. And then you start to see the visits by every state, also segregated by office and facility. Facility means a hospital outpatient center rather than a physician's private office. The fact that there are 46,000 office visits and 5,000 facility visits means that about 10 to 15% of Medicare services are now facility-based. You may have seen that yourself. You could be driving in the suburbs of, I don't know, Washington, D.C., and out there on the Beltway you see a big building that might say, someone's medical school clinic. Pick a medical school in Washington, and that's because they bought a suburban office practice and it might now be billing as a facility. So we will select office only with the pull down box. So we're going to pull down that box. We're going to select O alone and not F. And now we get only office visits 99202 that are in actual offices, not facilities. And we again have overall and the states. So we have now, in a few seconds, we filtered for 99202 office visit, and we filtered for place of service office, and it was that easy. We can also look at all these other columns. So 46,000 providers billed this service, and they billed a total of 2.4 million 99202 office visits. And the average payment was about $70. We can look down here, 155,000 of those services were in California, only 3,000 were in the District of Columbia. And now we'll go to the physician summary spreadsheet. I'm not going to look at this very much because we're trying to focus on individual codes and not all doctors, but the physician summary spreadsheet is 145 megabytes, 872,000 rows. It takes 90 seconds for me to open on my laptop. And you get the doctor's NPI number, provider last name, first name, credentials like physician, gender, street address, and then you get this data, so the number of HCPCS codes or CPT codes that doctor billed, the number of unique patients he saw, the total charges, and his total Medicare payment. So here's a guy who billed 18 different CPT codes for 106 patients and charged $1.4 million, and he was paid $500,000. Remember, in Medicare, you can charge any amount you want. You can charge $500 for an office visit. Medicare doesn't care. It will pay you, $70 or $80 for that office visit. So we're going to go to the documents library. I've downloaded all of the alphabetic physician databases. There's one for the A's, one for the B's, one for the CD's, one for the EFG's. And as I said, these are up to 200 megabytes and very slow to work with on a regular Windows computer. We're going to go to the YZ database because it's small. It's only 157,000 rows and only 26 megabytes. And let's remember what the structure is. I've mocked this up, but you get the NPI number, first name, last name, degree, gender, address, city, zip code. And then for this doctor, this is Dr. John E. Smith, and he's billed 5 different CPT codes. He's billed them different numbers of times. He's got an average payment for each CPT code. So this is the kind of data that we are getting into, shown here in a cartoon. So we now go to the database. I've shown you a screenshot, so you get zip codes here, and you get the type of physician that it is, or a physician assistant or physical therapist, and different HCPCS codes that they build, and the descriptor for that code, what it is in plain English. Here I have hidden the provider's zip code. I have sorted for 99204, which is the 40-minute office visit now. You can see there are different specialties. Here's an obstetrician, here's a surgeon, here's a urologist, here's a physician assistant. And they're in various cities, Tucson, Portland, Oregon, Youngstown, Ohio, Pittsburgh, Seattle, Oakland, and so on. And you can see how many times they billed the service for how many patients and how much Medicare allowed for that patient. Since we have jumped to 99204, which is a longer office visit, the Medicare allowable has jumped up to about $170. The Medicare allowable changes a little bit depending on what city and state you're in. This is the whole database. I've made it so tiny that you can't read anything, but it shows you how many different columns there are. And now we've zoomed in on 99204, and we can start working with the data in more detail. So here are 11 doctors from off the top. One's in physical medicine, next in family practice, next in urology. This is how many times they billed the 99204 office visit service, the 40-minute office visit. This guy in family practice billed 13 times, but this guy in physical medicine billed 123 times. These are new patient visits. And then the same 11 people, you can see their Medicare allowable. That's a fairly tight range, depending maybe if you're in a rural area, it's $157, but if in your city, it's $179. The standard deviation should be 0 because Medicare is going to pay him the same for every one of the office visits. And then you can see the charges submitted. I just pulled this for curiosity. This guy charges $358, but Medicare pays him $179 because that's the fee schedule. A little quirk here, this person charged $150, got paid $150. We don't know, but he might live in a place where Medicare pays $160 or $170, so it might have behooved him to charge more than the amount Medicare would pay, or at least as much. The amount he charges caps how much Medicare can pay him. If you want to use the sort function, which I'll show you next, I figured out that step 1 is to delete line 1, which is a copyright notice. So you click the row at the far left, the row will be highlighted, right-click, and then delete row. That's because this extra row would screw up your sorting. Now, some things I did that I won't show you. I hide columns I didn't need right now. You select the letter box at the top of the column, like column C, and you right-click and you select Hide. And that column will be temporarily hidden from view. Then I added a new column way over at the right, which became column AB, and I multiplied the lines of service, column Fs, times the average payment, column V. And that gives us this. So here we have some Virginia-based obstetrician. He billed $99204 13 times. Medicare paid him an average of $165, so Medicare paid him $2,145 for that code. Here is a urologist based in Ohio, 153 billings at $155, so Medicare paid him $23,800 for office visits. You can now go to the sort function. You just click in this box. Do not select the entire row or column, just click in the box, then come up here to the sort box and click sort Z to A, which is big to little. And now we have sorted all the doctors in the Y and Z names who billed Cpt code 99204, and we have sorted them by the amount they got paid. The highest paid person was in Florida. He got paid $98,000. You go down 10 or 12 places, and there's a Californian who got paid $49,000 by Medicare for these new patient office visits. Now, finally, this is quickly walks you through how to make a bar chart. You can also Google how to make a bar chart in Excel and figure this out pretty quickly. But number 1, you select all the data in the column. Now, there may be several thousand rows here, so you start at the top and pull your mouse down until you've selected all the data in the column. Then number 2, you go to Insert. Number 3, you select Bar Chart. And number 4, you select a simple bar chart. And then, presto, this actual bar chart will instantly pop up. And I'll show you that in more detail. So this is the calendar year 2012 amounts paid to about 2,980 doctors whose names begin with Y and Z who billed at least one 99204 code to Medicare. And there are a couple of them got paid north of $60,000. Only about 5 or 10% got paid more than $20,000 from Medicare for the new patient office visit. And then after that, it tails off. So a lot of doctors only get paid $5,000 or $10,000 or less for new patient office visits from Medicare under this particular code. I will now just walk through a few things you may find helpful. These databases are 30 to 200 megabytes, and they only contain physicians that begin with a certain letter or a couple letters. So in order to do this for a client project, you want to filter and hide columns that you don't need, and then select Control-A to select everything in that spreadsheet. And go to the very top right of Excel. There'll be a box called Find and Select, and then click Go to Special, and then click Visible Cells Only, and then click OK, and then finally click Control-C to copy everything. Now you've got a much smaller amount of data, so it's only the visible data, none of the hidden columns, none of the hidden rows, and none of the filtered CPT codes, filtered out CPT codes. So you can paste this smaller limited data you just copied onto a new sheet or a new spreadsheet. And this reduced, in the case we've seen, the 25 megabyte YZ database, when I filtered for only doctors billing for 99204 and only a handful of columns, became a 214 kilobyte database, which is much easier to use. but it's still only the YZ doctors. So for a client project, I went through all this for all dozen alphabetic spreadsheets, A's, B's, C's, and I created a final file for the client of only 300 kilobytes of data, which was every doctor in the US in a certain specialty that billed a certain specific CPT code. And once you filter down to a couple hundred kilobytes of data, it's very easy to keep playing with it, and you can filter by state and so on. I had to open and work with a dozen 200 megabyte spreadsheets, so it took at least an hour, maybe two. But the client thought it was really cool, and I had accomplished doing this with only basic skills in Excel and working from a 2 gigabyte CMS database that had 10 million lines. Thanks very much. If you lose track of this video or want to find the spreadsheet, you can go to my website, which is called discoveriesinhealthpolicy.com, or you can probably Google the word discoveries in health policy or the phrase discoveries in health policy and maybe the name Quinn, and you should be able to get to my website. And there I'll provide a link to the code, and I'll try to post the PowerPoint as well. Thank you.